Hello and welcome to the Society with Barrister Fatma Shaheen at PTB World. Considering that the first case of the Omicron variant was reported in Pakistan just a few weeks ago, and considering that since then the Omicron variant has been on a raging high, more particularly in cities like Lahore and Karachi, it is very important for us to sit back and think about the fact that how then can we stop the spread. It is very pertinent to mention at the outset that in countries like the US, the Omicron variant has already, burdened the healthcare system, and similarly, it is also predicted by WHO that in coming few weeks to come in UK and Europe, they might also have the same fate, which raises a very important question for us in Pakistan then, that why is it so important at this point in time when, this actual wave has started for us to stop the control? How exactly can we do that? What measures need to be taken in this regard? Do we need to increase our vaccination uptake? Do we need to ensure better compliance with the SOPs? And how, if at all, can we learn to live with COVID-19 in whatever form, in whatever variant form it does emerge, in times to come as a society? This and much more we are going to be talking about in our today's show. And to do that, let me introduce you to my today's panel. My first panelist for the show today is Dr. Javed Hayat, who's a consultant pulmonologist, alongside being a member of the Corona Expert Advisory Group. Assalamu alaikum, sir, and welcome to the show. My second panelist for the show today is Ms. Samavia Sajjad, who's an analyst alongside being a social worker. Assalamu alaikum, Samavia, and welcome to the show. And via telephone line, we'll be joined by Ms. Zara Vayani, who's a COVID-19 survivor, alongside being a social activist. Assalamu alaikum, Zara, and welcome to the show.
Walaikum salam. Thank you so much for having me on.
You're most welcome. Sir, I would like to start the show with you. There is this report based on hospital data from South Africa, which suggests that the Omicron-driven drive resulted in shorter hospital stays and fewer ICU admissions. How do you correlate this with the wave as it has hit Pakistan? Does this hold true for Pakistan?
I think in your opening statement, you have made some very pertinent statements,
right,
which is very, very important. You also mentioned we have been with it for the last 2 years, and Omicron came from South Africa in November and Pakistan in December. You also mentioned the surge in the cases in the last few days, which is very much expected.
Right, sir.
You mentioned the transmission is very, very high, which is indeed it is. As we know so much about corona in the last 2 years and all variants which come during this period of time, this is the variant which is transmission very, very fast.
It is deemed to be the most transmissible of all the ones
70 times more than the Delta virus.
Right, sir.
But the good news on the other hand is it's not as bad as Delta virus. It does not penetrate into the lungs as badly as Delta did. It's 10 times less potent on that matter. So on the one hand, we will see a lot of cases of Omicron. A lot of people will go off work in isolation. On the other hand, our hospital care system will not be pressurized like it was in Delta wave. So that's a good sign.
Right, sir.
Omicron.
But sir, as of now, like when, as we speak, because we have been seeing that the cases have been on a, raging high since the past few weeks, since Pakistan has been hit by this Omicron variant, so to speak. What kind of cases are coming in front of you? Are they those of children? Are they those of adults, of pregnant women? Who?
If you look back in the last 2 weeks since we have started having the Omicron, there has been no change in the pattern as compared previously.
To what it was before.
It's almost the same pattern. The number of admissions are almost flat. You have to go to the examples of US and Europe. Definitely, we are going to see a surge in cases in coming days and coming weeks.
Right. So, but from a common man perspective, a question which is often asked, which I'll put to you since we have the benefit of having you on the panel today, is that how do you distinguish this variant, which is, very in terms of its symptoms similar to the common cold and flu? So what then is the distinguishing factor? Because a lot of people in routine do get the flu and they do get the common cold. So how would they know that, they're actually just a patient of common cold and flu as opposed to being a patient of the Omicron, variant virus?
I think it's a very pertinent question. What we are suggesting is very difficult to differentiate the symptoms of Omicron from common flu. It also, unlike Delta, it has the same symptoms as flu, such as sneezing, coughing, running nose, fever, fatigue, muscle aches. Though it's very hard to differentiate. Or in fact, it's not advisable to try to differentiate. Management is the same. That's isolation. You protect yourself, you wear the mask, and you don't go out.
So possibly, sir, everybody who's coming in with a common cold or flu, they should be advised to isolate themselves.
Absolutely. Under the circumstances, if you want to contain the virus, so anybody who has a common cold should be assumed as if it is Omicron and should be treated as such.
And they need to be responsible in doing that too. Would you agree with what sir is saying? Because I was also going through this report which suggested that Omicron is that one variant in which it may be difficult to decipher and to detect, especially when it comes to the rapid antigen tests. And then some reports, sir was also earlier telling me, say the same with regards to the PCR testing. So do you not feel then that is placing too much emphasis on us as a society to be responsible, to be able to isolate ourselves the moment we feel that we might just be having symptoms which indicate that we might be having the Omicron variant?
Definitely. I think the ideal situation, like he said, would be definitely to isolate any person who even has a slight hint of common flu and cold as well. But practically, I think it is very difficult considering we've already been through this pandemic through years now. So
it's the third year, Samavia.
Yes, so it is very difficult for us to be able to tell this to people that you need to isolate themselves, especially in a country like Pakistan where already people don't take this pandemic as seriously as it should be taken.
And considering that the wedding season is also, on the raging high as it
yes,
is,
so they have
parties and whatnot.
Yes, so there have been dance practices, there have been weddings going on. Even if you go out on restaurants on weekends to step out, you don't see anyone following any SOPs at all.
We also saw in the previous 2 years since, the pandemic has hit us, they have been hotspots for the virus. So I think it's high time that now people should be more, cautious
Careful,
about it,
definitely.
considering that the transmissibility rate is also so high.
Yes, definitely. I agree with that because when you go out, you do see those cross signs on the chairs, but nobody follows them. So this is just an example of how people have taken this as a norm now instead of taking it as seriously as it should be taken.
Right. And I also think, Samavia, that now we've become more complacent with it, like we've accepted it maybe in some way or the other, especially the young people. I notice that this is something which is here to stay, and this is something that we need to get used to that way, which is in a way good, in a way bad too. Zara, I would want to have your viewpoint on this because you have yourself been a COVID-19 survivor, mashallah say. So how do you see our societal attitudes changing towards this pandemic, changing towards COVID-19 in the various forms, in the various variants that it did emerge from the time that it started in 2020 to now, that is 2022?
Very valid question, Fatma. I feel that when the pandemic first started, everybody was very scared. And people were taking a lot of precautions, and also from the social aspect, people were, unfortunately having to, be at home. Lockdowns were imposed, and and I think that actually really helped control it as much as it could be. Of course, it depends on what class of society one talks about, because a lot of people, especially daily wage workers, they were affected very badly, and they did not believe in the virus when it first came about. So, and from there, of course, when it moved on to the second wave, one hoped that it would only last for a year, but unfortunately, that didn't happen either. And it just keeps on having different variants. So when we come to, move on to the last one that's come on now, which is Omicron, I feel that a lot of people are saying, saying it's inevitable. A lot of countries, especially the UK, for example, has said that, no one has to test before coming into the country anymore. Whereas in the summer, only 6 months ago, we had to do about, 10 to 14 days quarantine. We have 3 different tests, spend a lot of money. So, mindsets are changing.
And also, what do you think about the stigmatization factor? Because that is something that was very prevalent when the pandemic started. The moment anybody got diagnosed with COVID-19, they were kind of stigmatized, not only them, their family members, their caregivers. Do you think that has also reduced with the passage of time? Because we, unfortunately or fortunately so, have become more complacent with this disease.
Yes, of course, because I contracted COVID in the second wave in Pakistan, and it was very hard at that time because I of course was very vocal about it because I wanted people to learn from my experience and how I tackled the same. a lot of people didn't want to say to anyone. There was some sort of stigmatization. One felt very guilty because you don't know when you contracted it and then how many you also passed it on to.
And I think the best thing about your case was that you were very open about it. So you did not stigmatize it per se. A lot of times I saw people who got COVID, they were so scared to even tell people about it.
No, absolutely. And that's exactly it. And now, and the sad part is that now when Omicron is, prevalent, a lot of people are not, don't want to talk about it. There's been weddings in Karachi which have taken place, and people have not, they haven't disclosed that the bride and groom are COVID positive, or they haven't gotten tested even though they should.
Which is very unfair, because you owe this sense of responsibility. You have this responsibility to tell people, because you could just be saving somebody's life. Your point is noted, Zara, but sir, coming to you, I think she made some very valid points, Zara, since she herself has been, a COVID survivor. So what role do you feel has media played in this regard? Because we do see media at one point, of course, for which they should be commended. They are educating people, they are informing the masses about the disease itself. But at the other end, we've also seen that there has been a lot of disinformation.
I think media played a very positive role, in fact, in highlighting what is corona and what to do to the public. Even you make a phone call, your ringtone is there telling you what to do, etc. But the other media, especially the social media.
Right, sir. I was referring to when I, referred to disinformation.
Right. Social media, if you remember, from very early on, was pretty active in spreading the disinformation or misinformation. The famous the case is when somebody, a scientist from France, said anybody who is vaccinated will die in 2 years.
Yes. And so recently I was just going through my Instagram and otherwise on social media. I was reading this report that, if you smoke weed, that in itself can help you, prevent you from falling victim to COVID-19. And if you have tobacco and nicotine, that can actually reduce the disease burden if you actually get it. So what do you have to say about myths like these, which are very commonly there since the pandemic started, about COVID-19?
Absolutely. Contrary to that, what you have mentioned, if you are a smoker and you have any lung problem, you are more susceptible to get a serious disease, not a mild disease. So this kind of disinformation really should not be spread at all without verifying it. So in last 2 years, there are so many examples you can give it. Starting.
So tell us from your real life experiences, what kind of examples have come to you, like patients coming in?
Yeah. Like you know that Sanamaki, people were using tons and tons of Sanamaki. You know, the people are using all kind of vitamins from A, C, D, E, whatever it is, they were giving it to and then some of the treatment, self-medication, people are doing it on including antibiotics as well. So there are all kind of myths over there, and it were being used. And despite the fact, we tell them, still they insist that no, this is true. And it not only in Pakistan, it's all over the world.
Of course.
WHO chief called it, it's not just a pandemic, it's also infodemics. This way the disinformation have been spread without any basis for that.
Right.
So that's one of the things which we learned during this pandemic.
But I think, sir, with passing time, I think maybe the influx of that disinformation has become less, because now people are more aware about the disease per se. And, I think now people are more vigilant too, because they do their fact checking probably more. Do you agree with that, Samavya?
I think to some extent, yes, people have become more aware now, especially because initially, because this came as a shock to the world, it came as a shock to Pakistan as well. So people were more willing to believe whatever information was being spread. And because they were also scared and they wanted to protect themselves, they took all the measures, like he said, Sanamaki, and there were several such herbal and home remedies which people were more willing to try. But now, because they know the time has passed and they know that this is a very sensitive and serious situation, they are more aware of it, definitely, yes. And people like Zara, they have also come forth on social media and they have talked about their experience. And I think that should be appreciated more in this sense.
Survivors, I think they have done a very good job this way. Even a lot of things have come up from celebrities, then from politicians.
Yeah.
People have been openly admitting the fact that, you know, yes, they have fallen victim to COVID-19, which is okay, of course, because it is a disease, anybody can get it at the end of the day. But, you know, moving on, what role do you feel has the society generally played when it comes to, you know, stigmatizing or for that matter supporting COVID-19 and different myths which do surround it?
I think there has been mixed roles by the society as well, because as the time passed and people were more aware of the coronavirus, or they were more aware that this is here to stay, there were certain people who started taking the edge that, you know, this justifies their act, so let's just put it on the pandemic and start doing it. Like you said, smoking weed or smoking helps. So there was sort of mixed opinion by the society as well. On the other hand, there were some people who actually sort of figured the situation out and they started taking it more seriously, and there were certain people, there was, for example, increase in wearing masks as well by the people. They stopped going to the gathering. So there has been mixed
I think at the end of the day, it depends that, you know, what circumstances you are in, what kind of socio-economic status you belong to, what level of education you have, and, you know, of course, what kind of people you're surrounded with at the end of the day. Because I've also seen people who do want to comply with the SOPs, they are actually made fun of that, you know, why are you so serious about it? Why they want to act cool about it, especially in the younger generation. Zara, coming to you, I think we must also talk about the link between COVID-19 and mental health. And as a survivor yourself, I would like to get your real life narrative on that. A lot of times I've seen that, you know, people who have been COVID-19 patients or who have come out of it, they've complained of severe depression and anxiety. So did something like that happen to you ever?
I was quite lucky. I didn't really go through any of that, but I do know of a lot of friends and a lot of other family members who did contract COVID, and it was very difficult for them to especially isolate. Being stuck in one's room with only, you know, even if you have whatever luxury one may, you know, want, it's not easy. And so I think it's very important to talk about mental health during COVID. A lot of people got affected, even if they didn't contract the virus itself. Even to be, you know, this working from home or being at home has also caused a lot of people a lot of mental trauma. Saying that, I do also would like to appreciate that when, you know, there are a few hospitals in Karachi specifically, which actually, especially the one where I got tested from, and once they found out that I was positive, I was regularly checked upon by a therapist. And she asked me how I was feeling and if I wanted to talk, and I had a number that I could access for the next 10 days after I was deemed to be positive.
Right, Zara, and it's extremely heartening to hear this, because a lot of time I've seen that, you know, a lot of people who have actually become COVID-19 patients, they complain that, you know, the depression or anxiety doesn't per se stem from the disease itself. It's more about being isolated per se. So I think you were extremely lucky that way, that you had somebody to talk to while you were basically, you know, COVID-19 patient. Sir, but coming to you, I think we must also look at this whole argument in a more positive context. We have seen that, you know, COVID-19 pandemic has given us that opportunity to look at our healthcare system, you know, in a more focused manner. We've also seen that people are now more, you know, concerned about their mental health. We are having such important conversations which we weren't earlier having. So as a frontline worker, how do you see this whole change?
There has been a definitely positive change from almost all segment of society. From the medical point of view, they now know we are the deficiency in the healthcare system, what we need to do for the future in case there is another pandemic, deficiency in diagnostics, deficiency in the management. From the public perspective as well, I think it's the first time they behave rather more responsibility. As you mentioned earlier on, there's a segment of society who was taking care all the SOPs.
We have seen so much CSR emerge as it is, sir, from different parts of the society, and this is not only something which is restricted to Pakistan. World over, we've seen this change. And so you're also the member of Corona Advisory Group. So, you know, how do you see the government working on this? Because I do understand that you have given some very important policy proposals with regards to, you know, control of the Omicron variant too.
As I mentioned earlier on, there was very quick response, and very focused response for the Omicron variant as well. for the last 2 weeks, they have been meeting regularly and monitoring what's happening in the country.
Right.
They are well prepared. The plans are in place in case there's a surge, in cases there's a pressure in the hospitals, what need to be done. So the exercise has been already done. They are very much ready for any surge. I think at the same time, the emphasis on the public behavior, they are being emphasized, go back. I know there's a fatigue. After 2 years, you want to get on with the regular life. You don't want to be interrupted. But I think still there's a little bit receptive, wearing the masks and trying to keep the social distancing. What has been pointed out earlier as well as you did that, this is a wedding season.
Right.
And we have several examples, people who came to Pakistan from outside and they got the disease and it is spread in one wedding which we know of.
So, of course, parties and weddings, they are all super spreaders at the end of the day.
They
but
are.
Why would they want to come to Pakistan to get the virus or vice versa that way? I think people need to be more responsible. I've stopped going to all weddings, attending all social gatherings, going to, any party or anywhere, where I could possibly be exposed that way. So, I think people need to own up to that too. Samavia, I think we need to change our societal attitudes this way because these are things which will remain. But I think we need to understand the fact that, this is for the greater good and we should not, make everybody suffer just because a few people from the society, they are irresponsible at the end.
Yeah, I definitely agree. But this again all depends on how much awareness can we create amongst the people. Like you said, that people have stopped taking this virus seriously, so they want to continue with the norms, and especially these days it's the wedding season. So everyone wants to attend the wedding as well, and they believe that it's going to put them in this embarrassing shoes if they say that they're not going to a certain gathering because they're trying to protect themselves or society from the virus. So I believe if we create more awareness in terms, maybe through social media, we can use it to the good as well. And like you said, celebrities.
But then social media is actually publicizing all these weddings, which is in a way normalizing them too. It's validating them.
Yeah, so but if you look at another picture, if celebrities or people like Zara, they come forth on social media as well and they share their experience and especially tell them that how this can also affect the mental health of people or generally the health of those around them. So that's something that's going to create a bit of impact. But then again, to change the societal attitudes, it takes a bit of time. It's a huge
But
challenge.
you're right, your social media needs to step in. Zara, what would your suggestions be in this regard, since you have been very vocal on the social media, not only about the fact that, you suffered from it, and then I also remember that you were giving updates about your disease, how it progressed, and then how it went down, and then how you came out of it. And right now we are having this conversation on national television as well. So how do you feel can our societal attitudes change, when it comes to, basically doing away with all this complacency, because we don't know for how long will this, pandemic remain with us?
So, initially when the first wave was about, there were a lot of forwards being, sent across WhatsApp, etc. There were lots of theories being passed around. A lot of people said, you must have this leaf and you must have, this device and that's going to help you. So that I would say, needs to be controlled at times because, that is something that can actually have a negative impact as well because too much of anything it cannot be a good thing either. But saying that, reason why I, wanted to make my COVID experience, so to speak, very public was because I feel, if you can sort of help someone else from your experience, that's the best way of doing it. And I think it's very important to do so also because, I remember that I had completed, because my COVID lasted for over 23 days. And I had a lot of symptoms for about 19 or 20 days after those 23 that I tested negative. So it was, it wasn't just because I was waiting to test negative. I was actively ill for a very long time. So I think, it was very important to put that out there. And apart from that, I also am aware that when I had put my final post up on social media, that post was also, and I said, "Ye mere saath hua tha, this is what happened to me, and this is what I've been through." And I think that's very important because then that sort of went and it was forwarded. So
and it also might have given others the motivation to actually talk about it. A lot of times when we see somebody opening up about such experiences, that in itself triggers motivation, that in itself encourages us to talk about such things more openly.
Absolutely. And that's something, and the fact that the right kind of information is put out there, because no one person's COVID experience is the same. I think it's very important for, people to feel okay to admit that they've gotten it and then to also help others.
Right, Zara, your point is noted. But sir, coming to you, I would want you to basically deliberate upon the vaccination drive, because you have been working closely with the government, have been an important part of this group in which you have been advising the government to. We have seen that the government has done a remarkable job when it comes to vaccination. But what about, sir, the rural areas? How equitable has the vaccination drive been in the rural areas?
I think if you look at the government set their targets, I mean, vaccinating 70 million plus by the end of last year, which they did. Then when you want, when you look at the supply, when you have a limited supply, then you have to target your priorities. If you look at the cases in Punjab, even in Sindh, there are 5 major cities which has brunt of cases. There are 20 districts in Punjab where the total cases over 2 years has been less than 5,000. And there are other districts where cases have been less than 10,000 in a whole year, and more than 50% cases are in Lahore. So Lahore being the hotspot, epicenter for this pandemic, the more focus was to vaccinate people in where the epidemic is. Lahore has been vaccinated, almost 50% eligible population has already been vaccinated. And you may have heard there was a drive recently, reach each door. So they were going from
and now boosters are also being, encouraged to those age 18 and over. Yeah,
absolutely. So there has been a very positive, well-organized campaign to vaccinate the people, and they were vaccinated almost 1 million a day, and there are too many centers were established within the reach of everybody.
Right.
You can walk in and get a free.
And the whole process was so expeditious. It was very speedy, very quick.
It was very quick, very speedy. Initial stages, yes, there were some hiccups. People have to wait for a long period of time before getting it. But that happens with everything new when it comes in.
Right.
But now you can just walk in, get yourself vaccinated, and campaign is going on very actively.
Right.
Almost.
So, but what about the rural areas?
As I said, because the number of cases in rural areas over 2 years has not been say too many which can bother you. So rural area is on the list, but the priority is on the major cities, which has been the major center of
right, sir. But considering Omicron is here and the transmissibility rate is so high, we can't say, sir, it can very quickly get to the rural areas.
Every district has the center. Every district has the center of the vaccination center. It's not that anybody is left behind. No, it's not the case at all. But since our rural areas spread out.
Of course, they're scattered,
Scattered.
The chances of catching the disease or the virus for that matter, that is quite less compared to urban cities, which are, of course, by their very nature, very close together.
Centers everywhere is rather difficult. It's major towns.
Right, sir.
It is already established.
Right. But, sir, what about the vaccine hesitancy? How do you see that evolving over a period of time? Because this is something which is just not particular to Pakistan. It is something that, we've seen in other parts of the world too. In the US, for example.
I think it's when you look at any hesitancy, where it comes from, is when you have a public trust in anything. When public trust in you, then they will get that medicine, treatment, or vaccination. How the public trust comes? Effectiveness of a medicine or a vaccine and the safety. In America, the concern was safety initially, because what the argument was, this vaccine, normal vaccine takes about 10 years to make it. But this one came within months. So there were a big question mark how safe it will be. Second was effectiveness. Effectiveness, nobody was sure it will be effective, but over a period of time, now it has been shown it's effective, it's safe. Billion of doses has been given all over the world, and we don't have many. Just there are minor side effects, there are some incidents, but no major side. And the third is a communication. How can you put to the people about the vaccination, the importance of vaccination and safety? I think over 2 years, almost everybody has gained experience. In one time in America, more than half people were reluctant, hesitant to get vaccinated.
So even in Pakistan, we see the same, like media campaigns, religious scholars vouching for the same, community engagement, and then, like you yourself very rightly pointed out, people, you know, going from door to door, awareness campaigns, they've been on the high. But I feel as a society, you know, that vaccine hesitancy, especially amongst women, because, you know, when the pandemic hit, when the vaccination did come, there was a lot of women who said that, you know, we'll not go for the vaccination because it might just affect our fertility and so many other things. I think that has also gone down.
Yeah, now it has, but still, when you talk about certain class of the society, like he was saying rural areas, I don't completely agree with that to the extent, because I think I was visiting this orphanage and I saw a lot of women and people in rural areas, they still don't believe that coronavirus exists. What they'd say is, they'd say that it's just a conspiracy theory, it's there, it's just like
and
any
again,
other
this
disease.
is something which has happened in the US as well. I remember when, you know, the pandemic started, there was this group of people who actually assaulted and harassed these frontline workers, saying that, you know, they've just made this up for a financial gain at the end of the day.
Exactly, and they think it's their right to get vaccine or to not get vaccine, so the government cannot force them.
Right.
And the similar trends have been seen in Pakistan as well, because when you visit these places, what those people say is that it's just their way of you know, maybe decreasing the population of the country, and that is why the whole thing came out that, you know, it might affect the fertility.
Of course.
So I think it has not exactly decreased to that extent like we wanted to, but certain acceptance has derived in our society to say that, you know, now we could go out there and get vaccine as well.
Right, Samavi, and I think in this regard we must also talk about, you know, the challenges that people have been facing in this whole pandemic, and as we live through the 5th Omicron variant in the 3rd year of COVID-19 as it did emerge in Pakistan, what are the challenges you feel patients or, you know, common people out there have faced, especially when it comes to, you know, accessing the healthcare system? And this is something again we have to remember, it might just continue because we don't know when this pandemic is going to end.
Yeah, so I believe that access to health, like already we know that there are certain classes in the society, and a health system in Pakistan is not as up to mark as it is in the other countries or in developed countries. So once such pandemic hit, it became even more difficult for people to get access to the health. Firstly, again, because there was no awareness of this virus, and then they were not willing to accept the fact that this has actually happened and it has hit us.
And so, even those who actually did fall prey to it, they weren't very quick to get, you know, quick treatment. I've seen a lot of people get serious just because they delayed hospitalization.
Because definitely it took time for the healthcare workers to also get trained. So even when people came forth, they were not taking it as seriously, or they did not know the protocol that is to be followed before admitting that patient, or before actually giving the patient the guideline on how to go about it.
Right, Samavia. But sir, in this regard, I would also want to put to you that, you know, initially during the pandemic, we also saw that there was this certain level of professional burnout, which we saw in the healthcare, in the frontline workers like yourself. And there was this instance when a few young doctors, they refused to work just because they were not given, you know, the proper protection equipment to work. So what are your views on that?
When the pandemic started, there were too many areas where nobody knew about it. Nobody knew how it's going to behave and what will happen. You may remember there were a lot of, at that point, a lot of information that on your surfaces, on your cardboard, on your handles and everything, it can transmit, it can stay for days over there. Similarly, the first case who was reported, eye doctor in China, he died of COVID. Then there were several cases in Italy as well, which suffered heavily. Health professionals died due to corona. UK was the same, America was the same. So there was genuine concern at that point that we need to protect our healthcare workers. Yes, it was decided at that point when they were not given proper gear to go and look after the patient, they had every right to say no, because we did not know much about that time of transmission. Even when the vaccination started with the healthcare workers in March last year, there were healthcare workers who practically refused to get vaccinated.
Right, sir.
There was a time in KPK, one full day, nobody, not a single doctor came forward, healthcare worker came.
And sir, I was also seeing that quite a few doctors who actually got it, they wouldn't even admit, they wouldn't even tell people, because they would be afraid that, you know, if we tell people, then we are also going to get stigmatized that way. And then I think from your narrative, you would agree with me on this, there was always this fear that, you know, when you go back home, you might possibly infect your families too. So I think there were a lot of challenges which were faced by frontline workers like yourself too in this regard. Zara, but coming to you and coming towards the conclusion of the show, what advice would you give to all the people out there, since you have yourself been a COVID-19 survivor, and since we don't know when this pandemic is going to end, that, what is it that they need to be very careful of, and why is it so important still to comply with the SOPs, regardless of the fact that we, unfortunately, as a society have become complacent when it comes to, complying with the same?
I feel that it's something that it may still be inevitable. A lot of people might still get it, but it's best to be careful, mask up, and just, I think from my experience, I feel that if you have gotten it, please be vocal about it. Tell other people so that if they may have been affected by you, they should know. And just learn how. One needs to now, I guess, learn how to deal with the whole virus instead of running away or shying away from it. So just to be safe and follow all the protocols that have been prescribed.
Right, Zara, and I think in this regard, we must also talk about the need for CSR, corporate social responsibility, as it has so emerged not only in Pakistan, in our society, but world over, where we see not only industries, people, organizations, companies giving back. Why do we need to have this all the more while we live through this pandemic?
So I feel that, so the responsibility part of it, the social responsibility, that aspect of it needs to be addressed as well, because there are a lot of people who got affected, especially during the year between 2020 and 2021, where they were, unfortunately, they didn't have anywhere to earn money from, and those were affected very badly. So I think as as members of society, we need to take on responsibility for those who cannot fend for themselves, especially when there is a pandemic going on.
Right, and considering that this pandemic has marginalized the marginalized even more, I agree with you on that, Zara, but thank you so much for being here on the show today.
My absolute pleasure. Thank you.
Sir, coming towards you and coming towards the conclusion of the show, what advice would you give to all the people out there, especially with regards to, Omicron, since we have been talking about Omicron on this show today, that, what are the best precautionary measures that they can take in order to steer clear of the virus?
Yeah, through your program, I think the important message which I would like to give it, that we need to stop the transmission of the Omicron and coronavirus. The only way we can do that if we prevent it passing on from one person to the other person. How you do that? Same, face mask, face mask, face mask, and the social distancing. And the second, vaccination. Once you are vaccinated, the chances of you getting infected get smaller, and transmission can also decrease. So two things important, save yourself and save your loved ones by wearing the mask, keeping a social distance, and getting vaccinated, no matter what vaccine is. It doesn't make a difference.
Right, sir, your point is noted. But coming towards you, Samavi, and coming towards the conclusion of the show, what would your concluding message be? How do you feel, as an analyst and as a social worker, how has the world order changed as we live through this pandemic? How have we as a society changed? And, what value system has this, pandemic taught us, or has it stressed upon? And how do you see us emerging out of this?
Yeah, so the biggest lesson this pandemic has taught us, I believe, is that whatever goal we are trying to achieve as a country or as a world as well, could it be environmental issue, could be this pandemic, we need to do it through mutual cooperation. Because if we don't stand up together against this pandemic, it's not going to help our society at large or Pakistan in general. So we need, starting from the home, if someone is detected or if someone is suffering from the virus, the person alone cannot prevent the virus from being spreading. The other family members need to help that person. Similarly, this keeps translating onto the society and then eventually onto the country as well.
Because, as they say that no one is safe until everyone is safe.
Exactly, that's how it is. So we need to come up together and we need to realize our mutual responsibility and then deal with this virus.
On that note, I would like to conclude today's show. Thank you so much, Samavia. Thank you so much, Dr. Saab, and thank you so much, Zara, for being here with us today. Well, to conclude today's show, we need to understand the fact that to avoid, all these endless COVID-19 variant waves, we need to ensure that everybody is vaccinated. We need to ensure that nobody has that vaccine hesitancy. We also need to ensure the fact that there is better compliance with the SOPs, be it in terms of, social distancing, be it in terms of wearing a mask. And we need to make people understand the fact that nobody is safe until and unless everybody else is safe. On that note, signing off for today. Until next time, take care and Allah Hafiz.